Welcome to the NCLEX over NCLEX. This is our part 7 of Fundamentals of Nursing Questionnaires. Pause for more time when reading the questions and rationales. Let's get started. Question number 1. A female client who has breast cancer with metastasis to the liver and spine is admitted with constant, severe pain despite around-the-clock use of oxycodone, Percodan, and amitriptyline, Elavil, for pain control at home. During the admission assessment, which information is most important for the nurse to obtain? A. Sensory pattern, area, intensity, and nature of the pain. B. Trigger points identified by palpation and manual pressure of painful areas. C. Schedule and total dosages of drugs currently used for breakthrough pain. D. Sympathetic responses consistent with onset of acute pain. Answer. A. Rationale. The components of every pain assessment should include sensory patterns, area, intensity, and nature, pain, of the pain, A, and are essential in identifying appropriate therapy for the client's specific type and severity of pain, which may indicate the onset of disease progression or complications. Triggers, B, current drug usage, C, and sympathetic responses, D, such as tachycardia, diaphoresis, and elevated blood pressure, are important, but should be obtained after focusing on A. Question number 2. The nurse is preparing to give a client dehydration IV fluids delivered at a continuous rate of 175 milliliters per hour. Which infusion device should the nurse use? A. Portable syringe pump. B. Cassette infusion pump. C. Volumetric controller. D. Non-volumetric controller. Answer. B. Rationale. A cassette pump, B, should be used to accurately deliver large volumes of fluid over longer periods of time with extreme precision, such as milliliter per hour. A syringe pump, A, is accurate for low-dose continuous infusion of low-dose medication at a basal rate, but not large fluid volume replacement. Volumetric, C, and non-volumetric, D, controllers count drops per minute to administer fluid volume and are inherently inaccurate because of variation in drop size. Question number 3. When the nurse enters a client's room to do an initial assessment, the client shouts, "Get out of my room. I'm tired of being bothered." How should the nurse respond? A. There is no reason to be so angry. B. Why do I need to leave your room? C. What is concerning you this morning? D. Let me call the client advocate for you. Answer. C. Rationale. C is an open-ended question that encourages the client to discuss personal feelings. A. Devalues the client and hinders further communication. Acting defensively and asking why questions such as B are likely to elicit more anger and block communication. By deferring to the client advocate, D, the nurse fails to even address the client's feelings of anger and exasperation. Question number 4. A single mother of 2 teenagers, ages 16 and 18, was just told that she has advanced cancer. She is devastated by the news and expresses her concern about who will care for her children. Which statement by the nurse is likely to be most helpful at this time? A. Your children are old enough to help you make decisions about their futures. B. The social worker can tell you about placement alternatives for your children. C. Tell me what you would like to see happen with your children in the future. D. You have just received bad news, and you need some time to adjust to it. Answer. C. Rationale. The nurse should first assess what the client desires. C. A. Is somewhat judgmental and attempts to solve the problem for the client without eliciting the client's feelings. Though a referral to the social worker, B, may be indicated, the nurse should first offer support. Time is likely to help the client cope with this news, D, but the nurse should first provide support and assess what the client wants to see happen with her children. Question 5. A 73-year-old Hispanic client is seen at the community health clinic with a history of protein malnutrition. What information should the nurse obtain first? A. Amount of liquid protein supplements consumed daily. B. Foods and liquids consumed during the past 24 hours. C. Usual weekly intake of milk products and red meats. D. Grains and legume combinations used by the client. Answer. B. Rationale. A client's dietary habits should be determined first by the client's dietary recall, B, before suggesting protein sources or supplements, A and C, as options in the client's diet. Although grains and legumes, D, contain incomplete proteins that reduces the essential amino acid pools inside the cells, the client's cultural preferences should be elicited after confirming the client's dietary history. Question number 6. A 4-year-old boy who is scheduled for a tonsillectomy and adenoidectomy asks the nurse, "Will it hurt to have my tonsils and adenoids taken out?" Which response is best for the nurse to provide? A. It may hurt a little because of the incision made in your throat. B. It won't hurt because you're such a big boy. C. It won't hurt because we put you to sleep. D. It may hurt but we'll give you medicine to help you feel better. Answer. D. Rationale. Answering questions simply and directly provides comfort for the preschool-age child and builds confidence in the healthcare team. D. A. Uses language, i.e., incision, that could create anxiety for the child. 4-year-olds are in the initiative versus guilt stage, Erickson's psychosocial development, and B. contributes to guilt when the child hurts. C. Is not helpful because the child may associate being put to sleep with the postoperative throat pain and then become fearful of going to sleep. Question 7. Last question. What is the rationale for using the nursing process in planning care for clients? A. As a scientific process to identify nursing diagnoses of a client's healthcare problems. B. To establish nursing theory that incorporates the biopsychosocial nature of humans. C. As a tool to organize thinking and clinical decision-making about clients' healthcare needs. D. To promote the management of client care in collaboration with other healthcare professionals. Answer. C. Rationale. The nursing process is a problem-solving approach that provides an organized, systematic, decision-making process to effectively address the client's needs and problems. The nursing process includes an organized framework using knowledge, judgments, and actions by the nurse as the client's plan of care is determined, and encompasses assessment, analysis, planning, implementation, and evaluation of client care. Thank you so much for watching. There will be more questions about fundamentals of nursing coming up soon. Let me know in the comments below what questions from your classes you prefer me to upload.